Construction of a hospital at Camp Lee began in November 1940 as America mobilized for her inevitable involvement in World War II. Camp Lee Station Hospital was ready for occupancy on 30 March 1941 with 871 beds. By October 1942, the hospital expanded to 2,000 beds. Camp Lee's hospital was redesignated a regional hospital on 7 June 1944, the day after Operation Overload, D-Day invasion, was launched. The hospital was downsized in 1947 when the bed capacity was reduced to 1,100 beds. The hospital was renovated in 1949 and redesignated U.S. Army Hospital, Fort Lee in 1950, when Camp Lee was named a permanent post. In addition to the redesignation, the bed capacity was reduced further to 200 beds. As part of Fort Lee's conversion from World War II vintage wooden structures to modern structures, groundbreaking for the current facility took place in 1959. Plans called for the new facility to operate 100 beds built on platform with the capability to expand to 200 beds. On 16 April 1962, Kenner Army Hospital was dedicated in memory of Major General Albert W. Kenner, Medical Corps, a veteran of World Wars I and II. The newly named Kenner Army Hospital was also referred to as a City of Care because it was an outstanding example of planning a community within itself, serving all active and retired military personnel and their dependents in the Fort Lee community. Kenner Army Hospital had all the medical treatment facilities necessary to ensure more than adequate medical attention to those requiring care. It was well equipped, air conditioned, and tastefully furnished. Aside from the numerous clinics, such as medicine, surgery, obstetrics and gynecology, emergency room, laboratory, radiology, eye, ear, nose, and throat, orthopedic, and dentistry, the hospital also featured a snack bar, post office, and patient library, medical library, barber shop, cafeteria, and dining room. The outpatient wing was added in 1975 through 1976, effectively tripling the square footage available for patient care. Completion of this project was followed by the renovation of the original building in 1977. A second renovation began in June 1996 in order to bring the facility in compliance with the life safety codes for an inpatient facility in the 1990s. The upgrade began in June 1996 and lasted until April 1997. Kenner Army Community Hospital received 2 Presidential Unit citations. The first citation was awarded in 1985 to recognize the innovative use of medical unit self-contained, transportable, MUST hospital operating room equipment during a renovation of the facility's operating rooms. The second citation was awarded in 1990 through 1991 to recognize outstanding support rendered during the deployment and subsequent demobilization of troops that participated in Desert Shield, Desert Storm. In July 1995, the Base Realignment and Closure (BRAC) Commission identified Kenner Army Community Hospital as one of several hospitals to downsize. On 1 August 1996, inpatient and emergency department capabilities were eliminated. On 1 October 1996, Kenner Army Community Hospital was officially redesignated Kenner Army Health Clinic. Kenner staff refocused their efforts and worked collaboratively to manage the tremendous changes effectively. Kenner currently has a staff of 94 military, 292 civilians, and 69 contract staff providing primary care and select specialty services to over 36,000 soldiers, family members, and retirees in the Fort Lee community. Kenner Army Health Clinic officially recognized the arrival of the Warrior Transition Unit, which was activated on 15 June 2007. The WTU's mission is to establish the conditions to facilitate the physical, mental, and spiritual healing process of warriors in transition. In 2007, the Kenner Army Health Clinic received reaccreditation from the Joint Commission with no deficiencies and positives regarding thorough biopsychosocial evaluation assessments. Kenner also implemented the new Disease Management Clinic to provide education and oversight for diabetes, asthma, and hypertension. The Troop Medical Clinic was renovated and expanded, which is a $1.3 million construction project. This project grew the TMC facility by 80%, affording Kenner the opportunity to consolidate its current two clinics into a single facility located in the brigade area. The Soldier Support Center was officially established as a separate entity. Fort Lee and Kenner experienced much BRAC growth in 2009 through 2011. To meet the growing needs of the soldiers of the Ordnance Brigade, Kenner set up Forward Sick Call at the new Ordnance Center and School campus. Renovations were completed of the Army Substance Abuse Program, optometry, and active duty clinic, which was an increase of 1,600 square feet. The veterinary clinic received a facelift and the building addition of 2,600 square feet. The WTU was deactivated June 2009, with soldiers assigned to the Kenner WTU being consolidated with the Fort Eustis WTU at McDonald Army Health Center. The patient-centered medical home model, which changes the way primary care physicians take care of patients. The new model emphasizes wellness, prevention, and patient education. It also allows for the use of electronic health recording and ultimately improving communications between the primary care physician, specialist, and the patient. The future for Kenner is bright as we continue to strive toward becoming a primary care center of excellence, supporting the growth and diversity of the Sustainment Center of Excellence in Fort Lee community, and maintaining operational control over our off-post health clinics at Camp Pickett and Camp AP Hill.